Hi everyone, my name is Ashton and I'm going to be talking about how exercise affects those living with multiple sclerosis. Before understanding how exercise can benefit those living with multiple sclerosis, we should first understand what this disease is. Multiple sclerosis is an autoimmune disorder that affects the brain and spinal cord, which make up the central nervous system. This abnormal immune response causes lymphocytes to cross the blood-brain barrier, enter the central nervous system, and cause inflammation. This results in breakdown of the fatty myelin sheath that covers and protects nerve fibers. As you can see in the picture on the slide, the nerve affected by MS is more exposed than a normal nerve, which means the nerve has less protection and insulation. This demyelination interrupts nerve signals to and from the brain, which causes various physical, cognitive, and neurological defects. Physical symptoms of MS include limb weakness, an unsteady gait, fatigue, muscle stiffness and spasms, poor balance, numbness and tingling in the muscles, and bladder problems. In addition, some may experience cognitive symptoms such as learning and memory impairment, double vision, dizziness, and depression. Not all patients with MS have the same symptoms, and these symptoms may be temporary or permanent. For example, some people may have new symptoms that occur but then go away partially or completely, while others may experience gradual and ongoing loss of function. There are 4 disease courses of multiple sclerosis. Relapsing remitting involves periodic flare-ups followed by full or partial recovery. Primary progressive involves continuous disease progression with little plateau or improvements. Progressive relapsing involves progression from onset with distinct relapses that may be with or without full recovery. Finally, secondary progressive involves the transition from relapsing remitting to a steady progression. The percentages below each describe the prevalence of each type among all of those with MS. The exact cause of multiple sclerosis is unknown. Research has found a genetic susceptibility to MS, however, the risk depends on the amount of genetic information relatives share. For example, first-degree relatives only have a 2 to 5% risk of having MS. Although the exact cause is not known, it is believed that both a genetic predisposition and environmental factors together can cause MS. A genetic predisposition, along with environmental factors such as exposure to infectious agents, vitamin deficiencies such as vitamin D and B12, and smoking may lead to MS by triggering a cascade of events in the immune system. How prevalent is multiple sclerosis? MS affects almost 2.5 million people worldwide, with about 1 million of these being in the United States. MS also affects women 2 to 3 times more than men, suggesting there may be a hormonal component involved. An interesting find is that MS is more common in places farther from the equator. In addition, most people are diagnosed between the ages of 20 and 50 years old. However, MS can occur in young children and older adults. Depending on the type of disease, different medications are used to modify the course of disease, treat relapses, and manage symptoms. The FDA approved disease-modifying therapies to reduce the number of relapses, delay progression, and limit new disease activity. These medications may be injectable, oral, or intravenous. Other medications are used to treat symptoms. For example, Botox has been used to treat bladder problems. Other treatments include therapies such as physical, occupational, and speech to promote mobility, safety, and independence. Cognitive rehabilitation programs evaluate and treat a person's ability to think, reason, or remember. Finally, exercise programs have been shown to improve symptoms of MS. For years, MS patients were advised to not participate in exercise because people believed it would worsen their symptoms and make them even more fatigued than they may already be. However, within the past few decades, research has shown the exact opposite is true. Benefits of exercise include improved cardiovascular fitness, strength, and balance, which are important due to muscle stiffness and diminished limb strength. Other benefits show less fatigue and depression and better bladder function. This short video shows how one man with MS is benefiting from an exercise program.
not as discouraged. I know that I can do it, and I do it.
Jason Hammond has made great strides since he first started coming to the Cape Coral Healthy Life Center.
I try to encourage everybody to keep a positive get-em attitude.
When he was 23 years old, Jason was diagnosed with multiple sclerosis. When he started losing his strength and hope, he decided it was time to change up his workout.
The best thing we can do is continue that exercise in the proper scope to keep what he has, improve on it where we can, improve that neuromuscular recruitment, keep those pathways active and awake, keep his flexibility up.
Multiple sclerosis is a progressive disease with no cure. It causes damage to the nerve cells in the brain and spinal cord. But health experts say exercise can help to increase strength and balance. 3 days a week, Jason meets with exercise specialist Bernie LaFarve to work on improving strength in his legs and core.
Drastic improvement, not just in his strength, but in the activation of the legs, how much his legs can fire off and the muscles get involved. He's made phenomenal progress.
Progress that Jason can feel both physically and emotionally.
MS doesn't have me.
Absolutely, my friend. That's my guy.
Using motivation and exercise, Jason inspires others to have a better quality of life.
Last set, make this one count.
For Lee Health, I'm Lindsay Morton.
What type of exercise should MS patients do? According to the American College of Sports Medicine, a combination of aerobic resistance and flexibility exercise is recommended for those living with MS. Aerobic exercise is important as it can help fight fatigue and increase endurance. Resistance exercise improves muscle strength, bone density, and balance to help prevent injury and address areas of weakness in the body. Finally, flexibility is very important for those with MS because it can help with muscle rigidity and spasms. It is so important that ACSM recommends flexibility exercises 1 to 2 times per day for 5 to 7 days per week. The picture on this slide shows ACSM's fit recommendations for those with MS. Aerobic exercise is recommended 2 to 5 days a week, and resistance exercise is recommended 2 days per week. In addition, it is important for MS patients to stay hydrated and stay cool because they have an increased sensitivity to heat, which could cause symptoms to worsen. Fatigue is one of the most common symptoms for those living with MS. The more sedentary a person is, the less energy he or she will have to work. This decreased physical activity results in even more reduction of muscle mass and further weakness and stiffness of muscles. This study, performed by scientists in Germany, aimed to determine the effects of high-intensity interval training on aerobic fitness and fatigue in patients with MS. Subjects exercised 30 minutes, 3 days a week for 8 weeks, either doing high-intensity interval training or moderate endurance training. It has been found that MS patients show abnormally low VO2 max values, therefore aerobic training is very important. This study concluded that those in the high-intensity interval group had an average improvement of 3 milliliters per kilogram per minute in their VO2 max. Based on a self-monitored fatigue scale, the study showed the exercise program significantly decreased fatigue in patients. Another study performed by Dr. Prakash, who is now at The Ohio State University, examined whether higher levels of fitness in MS patients were associated with preserved gray and white matter volume. Gray matter is the cell bodies in the brain tissue, while white matter is the fibers that connect various gray matter areas. 3 tests were performed in order to obtain results. A VO2 max test in order to determine fitness level, cognitive tests to assess processing speed and attention, and an MRI to reveal any damage to the brain. MRI results found that fitness in MS patients is associated with a larger volume of gray and white matter and less lesions, which explains why the higher fit patients did better on cognitive tests. The hypothesis is that aerobic exercise enhances nerve growth factors in MS patients, which increases the integrity of gray and white matter. Overall, the MRI test showed that parts of the brain involved in processing speed are all negatively affected by those with MS compared to the healthy control group, but less so in MS patients who are aerobically fit. At Oregon State University, their adapted physical activity team has an entire exercise program dedicated to those living with MS. Patients receive a customized exercise program and can interact with others living with MS. In addition to this one at Oregon State, many other hospitals and fitness centers have multiple sclerosis exercise programs. For example, the Ohio State Health and Fitness Center also offers group exercise sessions for those with MS. Exercise can help manage and improve many symptoms that those living with MS may experience. Because a variety of cardiovascular, strength, and flexibility exercises are beneficial, it is important that people living with MS find an exercise that they enjoy in order to improve their health, both physically and mentally. My test question is, what type of disease is multiple sclerosis? A, viral, B, autoimmune, C, blood, or D, endocrine? The correct answer is B, autoimmune. MS is an autoimmune disease in which the body's immune system attacks its own tissues and damages the central nervous system. Here are my references used for this presentation. Thank you all for listening, and I hope everyone is staying safe and healthy.